Thank you very much for the introduction, and let me also thank everyone here present. My presentation is on the concept of e-health or digital health readiness and its significance. Next slide. In literature, the term e-health continues to be replaced by the term digital health. Digital health, or the use of digital technologies for health, is a broad term encompassing e-health and other emerging areas as outlined in this slide. We can move on to the next slide. While digital health is documented as having potential to improve quality of service delivery, it also involves substantial investment where failure can be quite costly. Next slide. Failure rates of up to 70% have been reported. Most of these failures have nothing to do with technology, but a lack of e-health or digital health readiness. Next slide. A classic definition of e-health or digital health readiness, as said by Koja et al., reads, e-health readiness refers to the preparedness of healthcare institutions or communities for the anticipated change brought by programs related to information and communications technology. Next slide. An e-health readiness or digital health readiness assessment prior to implementation allows for a more informed and sustainable implementation. So as such, it is very important to understand where you are and strategize your implementation based on that. As you can see from this particular slide, your e-health program or your use of digital health or your digital health maturity could be at any one of these particular levels, from nascent all the way to an optimized landscape. Next slide. We did a critical analysis of existing digital health readiness assessment frameworks and noticed that none was completely adequate for use in the context of developing countries. Some inadequacies are highlighted in the next two slides of what were some of the shortcomings of these existing frameworks. This involves from assuming the presence of home internet connectivity and healthcare sector with established e-services, all the way to assuming the presence of adequate ICT infrastructure. These inadequacies continue on to the next slide, which you can project. Next slide. And also, we realize that in the context of developing countries, relevant stakeholders like community leaders could actually be the most appropriate individuals to provide correct information in terms of assessing public health readiness. Next slide. Ultimately, the result was the development of an e-health readiness assessment framework for guiding the process of e-health or digital health readiness assessment in the context of a developing country setting. And projected here is the framework itself. And by looking at this framework, it provides an insight regarding how multiple factors interact to influence the e-health readiness of a given setting. Emphasized in the framework is the stakeholder-specific assessment tools. Since the use of a single generic tool for e-health readiness assessment within any framework has the potential to negatively affect the validity of such an assessment. The framework also prompts assessment of e-health readiness to be conducted separately for each component of e-health. So in such a case, basically what it means is that the maturity of using mHealth does not necessarily translate to the maturity of using electronic health records or electronic medical records. When you look in the context of developing countries, where in most instances you realize that the mobile penetration is quite high, that might translate to a relatively mature mHealth landscape as compared to maturity of EHRs in the hospital setting. Therefore, it is important to do an assessment of each component separately. Also, highlighted in this framework is e-readiness, of which e-health readiness is just one component and has been defined as a measure of the quality of a country's ICT infrastructure and the ability of its consumers, businesses, and government to use ICT to their benefit. As such, the degree of e-readiness of a country has a direct influence on its e-health readiness. Also, the framework illustrates the central role that government needs to play in ensuring e-health readiness. This involves engaging all relevant stakeholders, and also political will is very important here. Also, assessment for the presence of relevant e-health infrastructure and infrastructure are highlighted in this proposed framework. So, since this is a framework, in order for one to perform an actual e-health readiness assessment guided by this framework, they obviously need to develop tools guided by the framework and also tailor-made to their particular settings. Thank you. Let's move on to the next slide. And this brings us to the end of our presentation. And at this point, I will invite any questions and comments, and all papers used in this presentation are there in the QR code displayed from the first slide. Thank you very much.